Hey y'all, welcome to the Share the Health podcast with your co-hosts, Amy, Caitlin, and Mariah.
This podcast is for women who feel frustrated by the failures of the traditional healthcare system and are looking for solutions.
We'll be diving into all things women's health, being a female business owner, and life as a woman. Now let's get into today's episode. All right, welcome back. So Amy, you were the one of the first people that I met when I was starting my business. So why don't you talk about kind of who you are and what your business is?
Yeah, so my name is Amy Newberry, and my business is Pelvic Prescription Physical Therapy and Wellness. And what that just means is that we are pelvic floor physical therapist, and we help women who are dealing with like bladder, bowel leakage, constipation, pregnancy pain, postpartum, birth prep. List goes on. Anything that has to do with peeing, pooping, and sex can summarize what we can help with. That's what I like to tell people.
I like
And
that.
that's a good, bringing it all together. It says
Yeah.
enough as is.
It's like people are like, oh, you're a physical therapist, and like, what do you do? And I'm like, you know what? Let's just keep it simple. Pee, poop, sex.
Yep. I like that. What made you want to go into pelvic floor physical therapy from just being like a physical therapist?
Yeah, that's a good question because when I went to PT school, I didn't even know that pelvic floor, actually, I didn't even know that the pelvic floor even existed, I think.
I think a lot of people do
Yeah.
until issues arise.
Exactly. It's like, I think when people are pregnant or postpartum, then people are like, oh, did you know? Blah, 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 blah. And so like, I didn't know until PT school. I didn't even like learn in college. And I took like exercise science classes and like anatomy and physiology. Maybe it just kind of, I don't know. I feel like we didn't really spend time talking about it. But even in PT school, it was like a 2-day lecture out of like the 3 years. So it was really nothing also. But my PT school professor, it was like her specialty. And she did the lecture and she was like, you know what, this is all we have time for. But if you would like to know more about what I do, then you're welcome to come shadow me outside of school hours. And so that's what I did, mostly because I was really intrigued by all of the devices she started passing around the classroom during her lecture. She would pass like those like Kegel weight ball things and like vaginal dilators and like a pelvic wand and all these things. And I was like, what is this? Like, where does this go? And I remember like one of the things she did. So something that like some pelvic floor therapists do is like we'll put like electrodes on like your butthole, but like next to it. And it will like measure the muscle activity. It's like surface EMG. And it will measure like if you do a Kegel, it'll show that you're doing it or not. And so she put it on one of my classmates, and my classmate like went out of the room, came back super like this, like really embarrassed. And we were like, where did they put those electrodes? And it was on her butthole. So after that, I was like, I gotta know more. Let me shadow you. Uh, and after that, I was sold. I was like, this is so cool and like weird. And I love it way more than like normal physical therapy.
I feel like that fits your personality very well.
I know. I feel like a lot of pelvic floor therapists, they're like, yeah, I was a normal PT and then I got pregnant, had a baby, and then that's how I became a pelvic floor PT. But for me, I'm like, oh, that's so weird. I want to do that.
And did you always know that you wanted to go into like physical therapy or like something in the health sector or something completely different?
Nope, no idea. Like in, I think college, I changed my major like 10 times. I was like an accounting major, like business. I did all sorts. I was like art history, like all over the
Taste everything at least once, you know?
Yeah, exactly. I was like, oh, that'd be really cool. Maybe I should be like an archaeologist. or like an ecologist. And then eventually I settled on like exercise and sport science, and that's definitely like where I was like meant to be, but I was all over the place. I had no idea. So I'm really glad that I ended up becoming a physical therapist, because I remember like my freshman year, my roommate and I were like just sitting on our dorm room, and we were like, man, I can't imagine like in 10 years, like I wonder what we'll be doing. Like what are we gonna pick, you know? So yeah.
Yeah. Do you feel like any of the other like stuff that you dabbled in helped you now, like with where you're at and having your own business?
I would probably say like yes and no. Like yes, because I feel like it does like give me mm, like there's more to like life than just like physical therapy for me. And then like starting a business is totally like different. Like I didn't learn how to do that. Like we're not taught that in school how to do that. It's just kind of like learning as you go. So I do feel like some of that experience of trying out different things and learning different things helped me be more adaptable for when it comes to having to learn something new, like having to learn how to run a business. So
Hmm.
yeah.
Yeah.
Mm.
Did you do any like internships or anything where you worked under like privately owned physical therapy clinics, or were you always with more of like a corporate while you were going through internships in clinics?
So my like official internships were all pretty corporate, like in the classic, what we call like patient mills, where it's just like churning out like lots of patients. Like I would treat like 4 patients at one time. And you wonder how, I don't know either. But I did have two like kind of, I wouldn't call it clinical because it was an elective that I created, where I took like a pelvic floor course, and then I could shadow slash like work with a pelvic floor therapist like one-on-one for about 4 weeks. And that was like a private practice, and it wasn't like a big box kind of chain clinic. And so that was my first exposure to a more like private, uh, kind of like higher quality care sort of environment. Mhm.
With
Did
that, were you
that,
able to get any business insight from being around them, or not really, just because you were more focused on
Yeah,
the
not really. I mean, I was just so focused on like learning the clinical side of it at the time. I couldn't like wrap my head around business. Although I feel like I always had a feeling in my like gut that I would want to do that one day, and I didn't know like how that would work, but I always had like a feeling I would in my head
Mhm.
when I like started my first job.
yeah, what was like the tipping point for you to want to either want to branch off into your own, or just make you start shifting the way that you're thinking about instead of just the clinical side of things?
Yeah, so I would say like probably in the middle of my first job, which this is also during COVID, or it was around the time when COVID happened. I had the idea, and I was like, yeah, I think I would like to do this. And I even started to like save the name, kind of knew like what business name I wanted. I like tried to save that and like save the domain and everything, but it still wasn't another like year and a half later that I actually like started the business. And that was when I guess the tipping point was working in a clinic that like was a smaller clinic. It wasn't like a chain or anything, but it was just the high like volume of patients that I was seeing, and some of the uh like requirements or things I was encouraged to do that I didn't agree with in terms of like billing certain ways and stuff. And so that was kind of like the tipping point where I was like, you know what? I am like really tired of being told of like how I need to like write something or bill something, or when I don't like agree or believe in that. And that's like not what I'm doing. And so I just wanted to like be able to practice more like transparency with like what I'm doing and like what I know is right for a patient. And I was like, you know what? I can do this on my own. Like I can just drive to someone's house with a table, some lube and gloves. Like that's fine. And that's how it started.
It's a
And
great
at this
start.
point, I've done pelvic floor exams. So a vaginal or a rectal exam in somebody's like garage, in a closet, in their bedroom, in the living room, the kitchen, with like a cat jumping on the table in the middle of an exam. It's really been it was quite an adventure in the beginning. And at first I was like, I don't know how to do this. Like, I need my treatment room. And then you just like adapt.
Yeah.
Man, I feel like I adapted. Like, I had my toddler in appointments with me where I'm like, all right, like, we just got to make this happen. And then I had the new baby and I was able to leave the toddler at home. But then I'm like breastfeeding while getting my internal exam done, and roll with it, make it happen.
Yeah, exactly. I know we've had so many, like I've had so many patients, yeah, like nursing while we're doing internal or, I mean, usually what moms would do would they'd be like, hey, can you come at this time? Like this is nap time. And so like I would come at like nap time and that like worked really well. But of course, they're wrangling like the cat and the dog and like, it's a whole ordeal. But it was really fun at the time when I was doing it that way, which I'm not doing anymore, but
Yeah, so why don't you kind of describe like how you went from being mobile to kind of where you are now?
yeah, so I was mobile for probably, I don't know, like 8 or 9 months maybe. And then I didn't do a great job with trying to coordinate when I was seeing people. So I'd be driving from like one part of town to like a whole other part of town, and it was just not efficient at all. And I think it was starting to get close to summer and, we're in like a tourist town. And so traffic started to get really bad and it was taking like double the time to get anywhere. And I was like, okay, I can't like keep doing this. And I was just like wasting time in my car. And so then I decided to just like rent a small room for like really, really cheap downtown Wilmington. And that's how it started. And I got to create a little space of my own. And it was really special. I still have like I made like a little plaque that had like the business name on it. And I still have that with me because I was like, oh, this is my very first
Yeah.
room. I got to make my own.
That is special. And now you're in a much bigger space.
Yeah, yeah. So now we are in there's like 5 rooms, but really only 3 of them are treatment rooms. So it's a lot bigger space with like a gym, which was like the vision all along to have like a gym space. And, you know, like my goal for starting my own business outside of, being tipped over the edge, was that I wanted to create a pelvic health clinic that catered to moms who like wanted to live an active lifestyle. Because a lot of pelvic floor clinics kind of have this, not that there's anything wrong with this, but you might like look around and everybody around you might be like your grandma's age or something, and they just don't have the equipment. There's not like weights there. There's like no barbell or kettlebell or anything for you to actually like train with. And we know like with muscle physiology that your muscles like need to be loaded and like need to be strengthened. And if you're not loading properly, you're not going to be rehabbing properly. And so I really wanted to help like those moms, be able to reach their goals. And so being in the small room was like fine, but I was like, man, I still can't do like what I really want to do. So having this like new space where we can actually challenge our patients appropriately and like load them up with what they want to do and actually assess them in the moment versus being like, go home and try this. And then I don't know, I'll like report back to me. Like that was very valuable. So I love being in the new space because I feel like it's what I can finally like practice what I like really wanted it to be.
Yeah, what's your vision, or like what do you feel like is next for you?
Yeah, that's a good question. I would really like, so last night or 2 nights ago now, I was, creating my vision board for 2024. And something that I thought about was for 2023, I feel like pelvic prescription grew like really fast, which was like really cool. But I think for 2024, I'd really like to see more like steadiness and consistency. So like my word for 2024 is going to be like consistency, so that we can really like fine tune all of our systems and make sure that we are, providing like the best care possible, while, having a steady flow of like team harmony.
Mhm.
So that's kind of my vision for this next year, at least, is just to have that like harmony and continue to like impact people like more deeply. Because I feel like, we are getting kind of like a wide reach, but it's not like super deep. And I would like to kind of hone in on that a little bit more.
Yeah, is there like a certain condition or like an audience of people that you're trying to connect with and reach?
Yeah, and I think Caitlin, like I think we've talked about this a little bit too, because a few months ago we did like a pregnancy kind of workshop. And
Mhm.
so something that, my team and I have talked about doing is doing like a birth prep kind of workshop specifically for like moms who are pregnant. Just because we know that during pregnancy, there are a lot of things that people can learn to actually prevent severe issues postpartum. And so like getting that prehab done before you give birth can like drastically improve your healing afterwards. Like we've noticed our patients that do all the prenatal stuff like recover a lot better. And so, and sometimes people don't want to like go through all of it. And so I feel like we're kind of missing a group of people who like don't want to do all of the birth prep, but they want the nitty-gritty of like, hey, these are the positions, this is how you relax your pelvic floor, this is how you should breathe, this is how you should blah blah blah, everything. And so we're thinking about creating like a birth prep workshop for those like patients.
Mhm. Yeah, I can see that being super helpful. I mean, I've definitely my husband and myself have both like talked to everybody about like you need to go and do birth prep because we felt way more prepared with like our second kid than with the first. We just like we were very willy-nilly with the first of like let's hope for the best. Baby's got to come out somehow.
That's impressive. I feel like usually it's like kind of flipped. People are like, "Oh my gosh," and then
Yeah,
whatever.
I was too scared the first time, so I went in with the like if you don't do any research, like it just has to happen, which is not the way to go. But I was just terrified. And this time I was like, okay, I know that I'll be okay. I've done this before, but let's be more prepared
Yeah, that's
and
great.
feel better about the outcomes.
Yeah, that's great. Yeah, do you feel like, I mean, you said you felt more prepared. Is there anything else you noticed, like between the first and second time?
Um, I felt like both of us, me and my husband, we both felt like we we were like more in control of the situation. Like we could, like say what we wanted. Like I didn't even know what I wanted the first time. I was just, yeah, not prepared. But this time we were able to like vocalize what we needed. And as soon as he was like, she wants to be in this position because it's best for her pelvic floor, the nurses were like, oh, if you know pelvic floor, we'll listen to whatever you say, and like helped me get in the positions
Oh,
um and then like the entire process was significantly faster.
gotcha.
uh, which I think there were lots of things that impacted that,
Yeah, that's
um, but yeah, I felt like much stronger pushing because I knew how to push and I was in a position that was comfortable for pushing and all of that.
yeah, okay. That's cool to hear just because like that's something that we're really passionate about. So it's good to know. And like from your experience, like we do like one-on-one like assess the pelvic floor to help and it's more direct. And so I was thinking for the people that come in for like this like group workshop, like they won't really get that part, but if they want to do that part later, they can.
Mhm.
Yeah. So yeah, that's sort of where I see like the vision going is just being able to kind of get to like moms before a problem happens. So that's what I really hope.
All right. Well, where can people connect with you?
Yeah, so we are super active on Instagram. That's probably our go-to platform.
That's how I
Uh,
found you.
yep. And it's at pelvic.prescription. And then I guess something else I would like to do for 2024 is, improve on, more information on YouTube. So like a platform that it's like easier to search, easier to organize, for like women to be able to like educate and like learn more on there too. So I can link the YouTube as well.
Awesome. So if people wanted to like get more information about scheduling an appointment, just go reaching out on Instagram is the best place.
Yeah, or you can go to the website. So our website is just www.pelvicprescription.com, and there's a little button there to be able to like book a chat.
Awesome. Well,
Cool. Thank
that was so
you.
much fun.
Yeah, this is so fun. I love talking about peeing, pooping, and sex. It's great.
All right. Chat soon.
Bye guys, high five.
Bye.